Hi guys, and welcome to another video. Today we will be reviewing some of the fundamentals of tendons and ligaments. We'll be talking about the differences between tendons and ligaments, how they function, the ligament categories, and common problems associated with tendons as well as ligaments. If you're new here, hi, I'm Julia Walker with Grey Duck Forge, and I make videos going over the main topics that come up on certification exams for farriers. I'm attempting to make these topics memorable and easy to learn, hopefully without making factual errors along the way. With that being said, let's dive into this topic. First up, we'll talk about the main differences between tendons and ligaments. Tendons connect muscle to bone and are inelastic. Those two facts should be memorized. Think of them like chains, not stretchy, just good for moving things around under tension. If you apply too much force to a chain, it won't stretch until right at the end before it gives out and then it will snap. The same is generally true of tendons. Ligaments connect bone to bone and are elastic. Keep in mind there are 10 important exceptions to the bone-to-bone rule in the leg that we are responsible for knowing. Ligaments are a lot more like rubber bands, though not quite as stretchy. They are designed to stretch a bit before damage is done to them, so they can stabilize joints and do other things without breaking. Much like rubber bands, if you stretch them too far, they will also tear. There are a lot of different types of ligaments, which Gregory's book divides into categories. We will browse through an overview of the main categories in today's video for a bird's eye view. The more complex categories that haven't been discussed in previous videos will get their own video in the series, such as the pastern and sesamoidean ligaments, annular and miscellaneous ligaments, as well as the 10 exceptions to the bone-to-bone rule. The sources for today's video are roughly the same pages in Butler and Gregory as the last video, where we looked at the main tendons and ligaments of the limb. So now let's talk tendons. First thing to know is they have beginnings, middles, and ends. Unfortunately, on the journeyman exam, you're going to need to be very familiar with all three of those for all of the tendons and ligaments of the leg. For certified candidates, if you can remember those, great, but otherwise it's more important to know what those words mean. The origin is where the tendon begins, which is actually where the muscle it's embedded into begins. Here, for the superficial flexor tendon on the hind leg, it's the distal end of the femur. An attachment is somewhere the tendon grabs onto as it goes by. Here, the superficial flexor tendon grabs onto the calcaneus bone at the point of the hock. Lastly, insertions are where the tendon ends by attaching to a bone. For the superficial flexor tendon, it's those dots showing the distal end of P1 and proximal end of P2. And that's the idea behind those terms, just telling you the important connections a tendon makes over its length. The origin, where it begins, attachments, where it grabs onto as it goes by, and insertions, where it ends. Now let's talk about the general structure of a tendon. There are two main formats we need to consider, where there's a tendon sheath and where there's a bursa. Tendons are frequently encased in a sheath, which is the body's attempt at protecting its huge exposed tendons in the leg with something more than just skin. The tendon sheaths are filled with synovial fluid and provide a bit of cushioning. The outside of the sheath is sometimes connected to the tendon itself with a structure called a mesotendon, which helps bring blood supply into the tendon from the outside. Tendons don't need a huge amount of blood supply, so it's not a huge structure. In some locations in the leg, there is an annular ligament that wraps around the tendon sheath and anchors on either side to the bone the tendon runs along, keeping the tendon from flapping around. When a tendon is instead cushioned by a bursa, it looks a little something like this. Oftentimes, an annular ligament is present in these cases as well. A bursa is a synovial fluid-filled sac that acts like a pillow for a tendon, particularly in higher force joints. In the coffin joint, for example, there's a bursa that protects the DDFT and navicular bone from harming each other. Obviously, no system is perfect, and we frequently see inflammation or damage to the navicular bursa on horses with navicular syndrome. So let's run through some problems that can occur with tendons. First, we have the most common problem we hear, the bowed tendon. That idea spans a few possible injuries, including ruptures to a tendon sheath, to the tendon sheath connection, like the mesotendon, ruptures to the origin or insertion of a tendon, or tearing within the tendon fibers themselves. We most commonly see a bowed tendon on the superficial flexor tendon. That's the main one to remember there. Synovitis is an inflammation of the synovial tendon sheath, a common one being wind puffs that can be seen in the fetlock. Lacerations to a tendon are also pretty problematic and often require special shoes for treatment called patent shoes. The outermost tendon is the SFT, then comes the DDFT, the subcarpal check ligament closer to the knee, and then the suspensory ligament. Usually, lacerations start on the outside and work their way in, so there's a good reason to know your anatomy. If you want to brush up, check out my last video. String halt is also associated with a tendon, specifically the lateral extensor tendon on the hind legs. It looks like involuntary spasmodic contractions of the LET as they walk, making them march with every step. So here's what a bowed tendon looks like on the left leg in the picture. It makes the tendon look like it's curved, like a bow. It's generally like towards the outside of the leg, so it makes sense that it would happen to the superficial flexor tendon most commonly. Here's a picture of some synovitis in the fetlock area, wind puffs. For tendon lacerations, the photos available were rather graphic and not very useful for instruction, so I chose to stick with the relatively clear diagrams. On the left, that's a severed superficial flexor tendon. Then you have a severed SFT and DDFT, which causes the toe of the hoof to lift up into the air. Lastly, there's a complete severing of the SFT, DDFT, and the suspensory ligament, which means the fetlock is totally unsupported and comes to the ground. The fewer structures get severed, the easier the injury is to treat. Then lastly, we have string halt, which is noticeable at the walk, where the hind end appears to march or goose step due to the involuntary contracture of the LET. So with those behind us, now we are free to discuss ligaments. There are some major categories for us to familiarize ourselves with, such as the 10 exceptions, the sesamoidean ligaments, navicular ligaments, pastern, annular, capsular, collateral, and the kind of miscellaneous ligaments. The two books don't necessarily list the same categories, meaning that Butler's book doesn't explicitly say there are X number of categories of ligaments, but more refers to them by type. Ligaments in general fulfill a lot of different jobs. They tend to hold in joint fluid by encapsulating joints, stabilize joints, reinforce tendons and joints, hold things in place, connect bones, the list goes on. Let's check out some of these types of ligaments. It's good to know some of the exceptions to the bone-to-bone rule. The overarching themes are that ligaments can also connect bones to tendons, cartilages, and even the ergot, all while still being called ligaments. Remember that the suspensory ligament is one such exception, since it connects the back of the cannon bone to the main extensor tendon. Other categories of ligaments are shown here. You've got the sesamoidean, navicular, pastern, capsular, collateral, annular, and miscellaneous. It's a good idea to be familiar with all of these, especially if you're going for your journeyman exam. There are, of course, lots of ways that ligaments can have problems, especially since there are so many types of ligaments in the leg. Sprains are the most obvious. Those occur when there is tearing or stretching in a ligament, but the bones haven't been pushed out of place. They are more common in some ligaments than others. Dry joint happens when a joint's capsular ligament is punctured, which can lead to ankylosis, also known as joint fusion. Curb is a sprain to or tearing of the plantar ligament, usually in the middle of it, which you can see on the back of the hock. That's one of the miscellaneous ligaments. Splints are sprains or tearing of the interosseous ligaments under the splint bones, which can lead to exostoses or extra bone growth where they occur. Cutting the ligament of the ergot instead of the palmar digital nerve during a low nerving procedure is another mishap that can occur, which isn't as much an injury to the horse as it is a surgical complication. So here's an example of a couple sprains in the fetlock area. It's a little bit confusing of a picture, but the original sprains are on the outside. Those are the originals of the graphic, and the 2-year follow-up pictures are in the middle. We start here and we work our way in, start here and work our way in. Okay. You can see how puffy things can get over a proper sprain. Remember, sprains are tearing or stretching of a ligament without the bones being misaligned afterwards. Dry joint occurs due to a hole in the capsular ligament where the joint fluid is able to seep out. This causes the joint to rapidly fuse, which we refer to as ankylosis. If you need a good way to remember ankylosis, remember that the horse's ankle is their hock, and we hear about hocks fusing all the time. Ankylosis is just joint fusions in general. Curb is a bump on the back of the hock due to damage to the plantar ligament. That's one of the miscellaneous ligaments that covers the backside of the hock, kind of from the end of the calcaneus bone down to the splint bone area. After being damaged, it swells into a lump, adding an extra bumper or curb to the back of the leg. Splints are usually pretty obvious to see. A horse with a freshly popped splint bone will tend to be pretty lame and will improve fairly quickly over time with rest. Often you can see a bump form over one of the splint bones, generally a little while after the injury occurs. The horse can either have their splint bone separate somewhat, or break the tip off of the splint bone, both of which are typically referred to as splints, but a break is sometimes further described as a broken splint bone. When a horse pops a splint, it's occurring due to damage to the interosseous ligament between the splint bone and the cannon bone. Our last ligament problem for today is the accidental cutting of the ligament of the ergot during a low nerving procedure. As you may be able to see below the fetlock, the vasculature is in pretty much the exact same place as the ligament of the ergot. It can therefore be difficult to distinguish the difference between the ligament of the ergot and the nerve, since besides the fact that they pretty much cross paths, they also look rather similar. It's a bit annoying for our veterinarian friends. But there we go. That was pretty much everything I had to say on that topic. Are you ready to review? Great. First up, which is more elastic, tendons or ligaments? I'll give you a second before I decide to tell you. If you guessed ligaments, you're correct. What do ligaments typically connect to bone? Easy. Ligaments connect bone to bone. What are attached to muscle? Tendons or ligaments? Tendons are embedded into muscles and connect muscle to bone. So it would be tendons. How many exceptions are there to the bone-to-bone rule? There are 10 exceptions. What fluid are bursa filled with? If you recall, bursa are filled with the second most obvious fluid in a horse's body, and that is synovial fluid, or joint fluid. Awesome job! Well, congratulations, you made it through reviewing the fundamentals of tendons and ligaments. Hopefully you learned something new, and maybe you were reminded of something not so new. We'll be continuing with tendons and ligaments in the following video, looking at the sesamoidean and pastern ligaments next. They're all in the same area, so I'm rolling them into one video, especially since sometimes they can be confused with each other. If there was anything I said today that was incorrect, please let us all know in the comments so we can be up to date with all the right information. And really, feedback of any kind is always welcome. Questions, comments, concerns, remarks, rebuttals, all fair game. But thanks for watching, have fun studying, and good luck on your exams, and, as always, stay tuned for more.